Do you know what bronchitis is and how it affects your body? Let's dive into this topic. Bronchitis is a condition that occurs when the lining of your bronchial tubes becomes inflamed. Now you might be wondering, what are bronchial tubes? These are the airways that carry oxygen to your lungs and remove carbon dioxide, a waste product of your body's metabolic processes. So when these tubes are inflamed, it can make breathing a bit of a challenge. Imagine trying to breathe through a straw that's been squished at one end. That's what bronchitis can feel like. It's a common condition, affecting people of all ages and walks of life across every corner of the globe. From the bustling cities to the quiet countryside, bronchitis doesn't discriminate. Understanding bronchitis is crucial as it is a common condition affecting many people globally. Stay tuned as we delve deeper into the causes, symptoms, and treatment options for bronchitis. Ever wondered what causes bronchitis? Let's dive into it. Bronchitis is commonly caused by the same culprits that give us the common cold or flu. These are the viruses that sneak into our bodies, causing inflammation and irritation in the bronchial tubes, the passageways that carry air to and from the lungs. But it's not just viruses that we need to be wary of. Bacteria can also lead to bronchitis, particularly in cases where the immune system is already compromised. But pathogens like viruses and bacteria are not the only causes of bronchitis. Our lungs are sensitive organs, and they don't take kindly to substances that irritate them. This could be anything from tobacco smoke to dust, fumes, and even air pollution. Long-term exposure to these irritants can result in what we call chronic bronchitis, a more severe form of the condition that doesn't go away as easily as the acute type. Smokers, for instance, are at a higher risk of developing chronic bronchitis. The smoke they inhale is filled with a myriad of harmful substances that irritate the bronchial tubes. Over time, this irritation can lead to inflammation and the production of excessive mucus, which are the hallmarks of bronchitis. It's not just smokers who need to be cautious. Even secondhand smoke can lead to bronchitis. So, if you're living with a smoker or find yourself frequently in smoky environments, you're also at risk. Now, let's talk about the air we breathe. In an ideal world, it would be pure and clean, but we all know that's not the case. Air pollution is a significant problem in many parts of the world, and it can be a cause of bronchitis as well. Dust, industrial fumes, vehicle exhaust, all of these can irritate the lungs and lead to bronchitis. So, now we know that bronchitis can be caused by viruses, bacteria, and exposure to lung irritants such as tobacco smoke, dust, fumes, and air pollution. It's clear that our environment and lifestyle choices play a significant role in our respiratory health. Now that we know the causes, let's explore the symptoms of bronchitis. How does bronchitis make you feel? What are the telltale signs? Imagine a persistent cough that brings up mucus, a feeling of fatigue that seems to envelop your entire body, and a slight fever that sends chills down your spine. These are some of the typical symptoms that may suggest bronchitis. The most common symptom is a hacking cough. This isn't your ordinary cough that comes and goes. No, this one lingers. It's a cough that may last for several weeks, even after other symptoms have disappeared. The cough often brings up mucus, which can be clear, white, yellowish gray, or green in color. Sometimes in severe cases it may be streaked with blood, but a cough isn't the only sign of bronchitis. You might feel unusually tired, a kind of fatigue that seems to seep into your bones. This is because your body is using energy to fight off the infection. Along with this, you might experience a slight fever and chills, your body's way of battling the bronchitis. Chest discomfort is another common symptom. It's a feeling of tightness in the chest, almost as if someone is squeezing it. It can be quite unsettling, but it's a result of the constant coughing and the inflammation in your bronchial tubes. Shortness of breath is also a symptom to watch for. You might find yourself gasping for air after climbing a flight of stairs or walking a short distance. This happens because the bronchial tubes, which carry air to and from your lungs, are inflamed and filled with mucus, making it harder for air to pass through. It's important to note that these symptoms can be worse in people with other underlying health conditions, such as asthma or heart disease. And while these symptoms can be quite discomforting, they are your body's way of signaling that something isn't right. Recognizing these symptoms early can lead to prompt treatment. So, what are the treatment options for bronchitis? And that, dear listeners, is what we will delve into in our next segment. Stay tuned. Bronchitis is treatable, but how do doctors usually handle this condition? The treatment approach for bronchitis can vary depending on whether it's acute or chronic. But let's start with the basics. If you're diagnosed with bronchitis, your doctor might recommend rest and plenty of fluids to help your body recover, and to loosen up the mucus in your lungs. It sounds simple, but trust me, it goes a long way. Over-the-counter pain relievers can also be helpful to manage any discomfort or lower a fever if you have one. Just remember to always follow the package instructions unless your doctor tells you otherwise. Now, some of you might be wondering about antibiotics. Here's the thing, antibiotics are effective against bacteria, but most cases of bronchitis are caused by viruses. That means antibiotics won't always be the answer. They're only prescribed if your doctor suspects a bacterial infection. Another important aspect of treating bronchitis, particularly chronic bronchitis, is to quit smoking. Yes, it's tough, but it's crucial. Smoking damages your airways and makes you more susceptible to bronchitis. In cases of chronic bronchitis, ongoing medical care might be necessary. This could include pulmonary rehabilitation, a program designed to improve lung function and quality of life. Regular checkups are also vital to monitor the condition and adjust treatment as needed. In severe cases, oxygen therapy might be needed to help with breathing. But remember, every case is unique. What works for one person might not work for another. So if you're dealing with bronchitis, don't self-medicate. Always consult a healthcare professional. They'll guide you through the process and make sure you're getting the right treatment based on your specific situation and overall health. One final note, prevention is better than cure. So, washing your hands regularly, getting vaccinated, and avoiding exposure to lung irritants can help prevent bronchitis. With the right treatment, bronchitis can be managed effectively. Let's summarize what we've learned. Bronchitis is more common than you might think, but it's also very manageable. So let's recap what we've learned today. Bronchitis is a respiratory condition that occurs when the bronchial tubes, the airways that carry air to your lungs, become inflamed. This inflammation can cause discomfort, breathing difficulties, and coughing. The two types of bronchitis are acute, which lasts a few weeks, and chronic, which can persist for several months or longer. We've delved into the causes of bronchitis, highlighting that it's often a result of a virus, similar to those that cause the common cold or influenza. However, it's important to note that environmental factors such as exposure to tobacco smoke, dust, air pollution, and even certain occupations can increase your risk. Chronic bronchitis is often associated with long-term exposure to irritants that damage your lungs and airways. We've also covered the symptoms of bronchitis, which primarily include a persistent cough that brings up mucus, shortness of breath, chest tightness or discomfort, and fatigue. It's essential to remember that these symptoms can also be indicative of other respiratory conditions, so it's crucial to seek medical advice if they persist or worsen. When it comes to treatment, we've discussed that for acute bronchitis, rest and hydration are often enough, along with over-the-counter remedies to manage symptoms. However, if you have chronic bronchitis, you might need long-term medical treatment. This could include pulmonary rehabilitation, a program to improve lung function, and medications like bronchodilators to open up your airways or steroids to reduce inflammation. In severe cases, oxygen therapy might be necessary. But let's not forget that prevention is always better than cure. Avoiding irritants like tobacco smoke and maintaining a healthy lifestyle can significantly reduce your risk of developing bronchitis. Regular exercise, a balanced diet, and adequate sleep can all contribute to a healthy immune system, better equipped to fight off infections. In conclusion, bronchitis is a condition that, while common, can be managed effectively with the right care and treatment. If you or someone you know is dealing with persistent respiratory symptoms, don't hesitate to seek professional medical advice. It's all about being proactive and informed when it comes to your health. Remember, knowledge is power. The more you know about conditions like bronchitis, the better equipped you'll be to protect your health and the health of those around you. So keep learning, stay informed, and make your well-being a priority. And finally, let's reiterate a key message that's worth repeating. Remember, your health is your wealth. Stay informed and take good care of your lungs. After all, every breath we take is a testament to the incredible work of our lungs. So, let's do our best to keep them healthy and functioning at their best.